So every year, May is Mental Health Awareness Month. And as UKARA, we decided to partner with different organizations, mental health organizations in Western region, to make sure that we let everyone know that mental health is real and it should be made a priority. This year's theme is make your mental health a priority. As you get headache, you go to buy Panadol. You get headache, you go to see a doctor. You should also seek for support the moment you feel that you're not well, especially when you feel you're stressed, you're depressed, you have anxiety. Make sure you get the professionals to help you in that. So as UKARA Mental Health Services, we organized this mental health awareness run, which is going to take place on the 31st of May. We are going to start from Rotary House, which most people know as CPP or Children's Peace Park. We shall set off at 6:30 a.m. 31st May will be a Sunday. We shall set off at 6:30 a.m. and the kit goes for only 30,000 Ugandan shillings. So members, we are requesting for your support. We have to make our mental health a priority. You have to first look at yourself before helping others. When something is not right, make sure that you seek for support. So as UKARA, all the proceeds that we will get from this run are going to help us to reach to different schools. We organized one last year and it pushed us to different districts in Western region, which is Mbarara, Shema, and Rubidizi district. But Western region has very many districts. So it's our wish and prayer that we get to many districts and schools as well, because there are very many challenges. I may not mention all of them here, but there are very many challenges these students of ours go through. You're going to see your child, you have 2 children, but you find one's behavior is really not good. But as a parent, have you ever talked to that child? Do you know why that child is performing poorly? You may not be knowing, but we've interacted with some of the students, then they have opened up, especially boys. It has been really a challenge for boys to open up, but when we visit schools, we encourage them to open up, to talk, to say whatever is disturbing them. You may look at it and you feel that it is something small, but this something you call small is torturing your child. You may give 1 million to your child as pocket money, but your child wants 2 million. So have you ever told your child that, look here, 1 million is even more. This is someone's tuition. So these are some of the things that we educate your children. We tell them, we let them know that it is okay to open up, and you shouldn't really, when someone opens up, you shouldn't segregate them, you shouldn't pinpoint them or backbite them because they have shared their challenges. So we kindly request for your support so that we go to different schools, we teach them, we create awareness, we give them counseling, so that your child, if your child has been performing poorly, you never know. Through our talks and guidance, there can be a change.
My name is Marina Salma. I'm a city woman councillor elect, and now I'm the deputy speaker for Mbarara City South Division, and I'm the deputy treasurer for Uganda Urban Speakers Association. I want to take this opportunity, first and foremost. I want to first appreciate the UKARA team, UKARA Mental Health Services, for organizing this run. We cannot take it for granted as Mbarara City Council. We cannot take it for granted. We want to appreciate you for the effort you're doing. Secondly, I want to also appreciate the organizations and the teams that have come up for this cause, because it is not easy to our communities, because we as leaders, we've been facing challenges when it comes to mental health, and we want to appreciate you for coming up with this thing. First and foremost, we as community leaders, we've been facing a very big problem when it comes to mental health, because in our communities we've been having challenges of domestic violence, and it has been affected so many women and children and even men as well. So we've been having those problems of mental health, and most people have been ignoring it. They don't see it as an issue. So we appreciate this team that has come up to solve this problem. And we as leaders, we are so happy, and we are going to work together with the team for this cause. because the community has been facing a lot of challenges when it comes to mental health. What do we say when we talk about the mental health? We've seen so many people run mad. People think running mad, it may be witchcraft and these other things, but there are so many things that bring up the mental health issues. For example, we've been seeing so many poor people, if they don't have money, they run mad. Because of that, we've been seeing people having issues with their marriages, and instead of going to get counseling and other things, they keep quiet and they end up being mentally ill. So we want to appreciate this team. We want to pledge that we are going to be with you. We are going to stand with you. We are going to do anything that is possible for us to join and work with you people. Yes.
Our dear viewers, my name is Bakashaba Ruhanga Ambrose, and one of the people highly passionate about mental health. I've been doing this for, I think, about now 3 years, ever since I left school. And I really find it one of the areas that are still lagging behind, and one of the reasons as to why we are gathering here today to talk about this. So we partner with UKARA Mental Health Organization, and our reason for being here today is to inform the public that we have a run that is going to be on the 31st of May, 2026. And in this run, we aim to raise funds, which funds are going to be used to create much more awareness. As you well know, that May is always the Mental Health Awareness Month all over the world. And we are doing this basically to ensure that almost everyone actually gets to know about mental health. Now, you well know that every person that has a brain is actually liable to mental health challenges. And now, unlike for other physical illnesses, or illnesses like cancer, malaria, and many others that you know, that there are those signs that will be seen, and most of the times we always rush to the hospital. Now, when it comes to mental health, the challenge that we have is that sometimes even us who are affected, we do not have the insight, or even us, we are not aware that we are actually suffering. So one of the reasons as why we need to create awareness is to ensure that actually people get to know about what they can, those signs they can actually use to identify. Because like I said, most of us who are affected do not actually know that we are affected. And it is only those people that are around us that can actually witness or identify some few signs that might make them suspicious that this person could be having mental health challenges. So now, like our team leader has said, that we did so much with schools. So in schools, there are quite a number of things. And as opposed to the tradition, back then, even us, we well know that even teachers actually are able to identify these things. But sometimes you find that these things happen in schools and even the teachers themselves are affected. If you consider the reports coming through, you hear so many suicide cases. Even here in Mbarara, you've had several cases of suicide in some schools. And this is not something that we can just keep quiet about. It is something that is really concerning. We've had teachers involving themselves in betting, drug abuse. They drink so much alcohol and come to class very early in the morning. And then it looks like it's normal, but there is always a reason behind. And for us, our aim is to ensure that we actually make you understand what are some of those cases that we really need to look out for and how do we deal with them.